Hi, here we are with our patient Paul. Paul is a patient from about a year ago. We did one MAXHARVEST hair transplant procedure on Paul, and he is here not only for his follow-up visit, but he's actually here for more hair, believe it or not. Paul happened to have had genetic hair loss where he was prematurely losing his hair at a very young age. His full frontal hairline was gone, and he was getting pretty thin in the crown as well. Paul had already been on Premature, which is what we recommend to each and every one of our patients, are the preventative treatments, Premature, Rogaine, and the laser comb. All three FDA-approved treatments help keep what you have. Was there anything unusual with the healing process?
No, everything was great.
What did all your friends and family think about everything?
They're just floored by the difference. I mean, just amazed. I've seen relatives that I haven't seen in a long time that are just, blown away.
Wow. And how about yourself? What do you think, more importantly?
I'm extremely happy. I'm back for more, so.
Okay. Alright, so let's take a look at what we did on our patient Paul. When we do that MAXHARVEST hair transplant procedure, what we're always trying to do is move as much hair from the donor area to the areas that need it, the recipient areas. So let's take a look at the hairline and I'll show you what we did. So all of this has been recreated. So when we look at this, as you can see, this is his new hairline. It brings his face really nicely. It has all the tiny little soft grafts, little tiny one-hair grafts around, which give it that nice softness the entire way across. Just maybe kind of take your chin over it. Then once we get behind those little softer grafts, we use a stronger graft. Now we call it the Bolton Bundle, but it's a multiple follicular graft that has multiple follicular units in one graft. And then it allows us to achieve this density. So it allows us to create more density for the patients. And kind of show you what we did all the way around. We worked on our patient's crown as well, so I'm going to have you kind of take that over here. So what we did back here is we created a spiral. The spiral is what feeds the direction and angles of the hairs. And when you see the before and after pictures, you'll be able to ascertain the difference between his previous look without the transplanted hair versus how it looks today. When we do that MAXHARVEST hair transplant, we always want to harvest as far as we can go from one side all the way around to the other side. That's the suture line right there. You're looking at the line right there. Okay? So that's the suture line. And then this kind of just comes around all the way through like that. So that little line you're seeing hidden underneath there is the suture line. So right through there, that's the suture line right there. You're staring at that suture line right there. And then that comes all the way around.